Okay, now for the sixth disease, which we refer to as roseola. What's interesting is this is a maculopapular rash disease that may not have a rash. We're finding that a lot of patients who are showing up in the clinics and the hospitals, seeing their doctors, their nurse practitioners or whatever, while they have a roseola infection, they don't have a rash. What they do have is an extremely high fever. It's been recorded that the fevers can get as high as 105. Okay, 103 for more than a day, and they're wanting you to go to the hospital, to the ER. 105, as soon as you hit that, yeah. Anything over 103, just go ahead and pack up little Johnny, little Susie, get their butts to the ER. They see that this is a fast onset fever. Okay? Fast onset fever that can last up to 3 days. Problem is with these very high temperatures, it can mess with central CNS, PNS, central nervous system, peripheral nervous system interactions, which can lead to, which we'll see as seizures. Okay, high fevers can lead to seizures. For the patients that don't have the rash, they're going to see that, well, by the fourth, fifth day, fever goes away. And then they start to see the rash. Chest to trunk, maybe face, definitely not on the limbs. Child's going to be sick, extremely high fever. After a few days, the fever will break, and that's when the rash will occur. Caused by human herpes virus 6, HHV 6. Okay, side note, you're going to see there are quite a few human herpes viruses. Okay, herpes viruses don't cause more than just the STD you've always heard of. So don't freak out when you hear this and think, oh my God, it's an STD. No, it's just a collection of viruses that all are in the herpes family. Okay. What we find is, like most herpes viruses, this one can infect and then be latent. Little Johnny, little Susie gets a high fever for a few days, may or may not have seizures. Fever breaks, rash appears. After about a week, rash is gone, but they still have the virus. You may see a few years later, same thing repeats again and again and again. But on these repeated it's not a reinfection, on these repeated outbreaks, the disease progression is going to be different than the high fever 3 days leads to rash, a week later done. No, here you're going to see, since the virus has spread to other organs, other tissues, you're going to see different clinical presentations. Um, Literally, as the textbook says, it's going to be a mononucleosis-like or hepatitis-like. Hepatitis means liver inflammation, so they're going to have some liver issues. But when they go and they run the test, well, you know what? We don't see any hepatitis virus. We don't see anything that could be causing this. Well, turns out it's HHV6, a latent reoccurrence. Turns out everybody's got it. This is one of those things that everybody just seems to get exposed to. As of now, no treatments, no prevention. Okay, because for the most part, kids get it, and within a week or so, they're back and up and running around. For those people who get the latent infection, it sticks around through adolescence, teenage years, into adulthood. Well, it pops up. They get that reoccurrence, and then it's just palliative care to make them feel better.